Hi, everyone. Thanks for joining me for our third live LDNDoctor.com webinar. Due to such positive responses from our last two webinars, we decided to hold another webinar with a detailed look at the benefits of using LDN for a specific condition. And today we are talking about fibromyalgia. For those of you who don't know me, I'm Dr. Handler from LDNDoctor.com. At LDN Doctor, I use LDN for a variety of issues, some of which are IBD, MS, depression, anxiety, chronic fatigue, autism, and of course, fibromyalgia. So let's first start off with a deeper look into what fibromyalgia is. Fibromyalgia is a chronic condition in which a person feels pain in the muscles and tissues surrounding the joints. The main symptom is widespread pain, particularly at certain pressure points or tender points on the neck, shoulders, back, hips, arms, and legs. The pain is usually described as a burning, throbbing, shooting, and stabbing. The pain may be accompanied by chronic headaches, strange sensations in the skin, insomnia, irritable bowel syndrome, PMS, and painful periods, anxiety, palpitations, memory impairment, irritable bladder, dry eyes and mouth, dizziness, and is often accompanied by depression and fatigue. The symptoms come on gradually and increase in intensity. The symptoms can be made worse by overexertion, stress, lack of exercise, anxiety, depression, trauma, extremes of temperature, and or humidity, and infectious diseases. 9 in 10 fibromyalgia patients are female. While the cause of fibromyalgia is unknown, researchers have found pain processing abnormalities in the spines and brain stems of some people with fibromyalgia. Researchers also performed brain imaging called single photon emission computed tomography, or SPECT. The imaging showed that women with the syndrome had blood flow abnormalities in their brains. The abnormalities were directly correlated with the severity of disease symptoms. An increase in blood flow was found in the brain region known to discriminate pain intensity. Still, while there is no clear single cause of fibromyalgia, there is some evidence to the cause being a problem with the immune system. Leaky gut is often found to be present. The development of allergies and other autoimmune disorders is often experienced. Let's review what we know about diet and fibromyalgia. In one study, investigators reviewed medical charts of 17 fibromyalgia patients who agreed to eliminate common allergic foods from their diet, such as corn, wheat, dairy, citrus, soy, and nuts. After 2 weeks without eating any of the potential food allergens, nearly half of the patients reported significant reduction of pain, and 76% reported a reduction in other symptoms such as headache, fatigue, bloating, heartburn, and breathing difficulties. After the food elimination phase of the study, the patients were then instructed to reintroduce a particular food every 2 or 3 days and to monitor their reaction to the food. Some of the reactions to foods were pain, headache, and GI distress. The most common problem-causing foods or ingredients for the patients in the study were corn, wheat, dairy, citrus, and sugar. It is really important to eat right. Patients with fibromyalgia must avoid processed foods and get more whole foods into their diet, both organic and locally grown. There are studies that show that fibromyalgia is associated with magnesium deficiency. I almost always recommend magnesium supplementation with a high quality magnesium supplement. There are other supplements that are believed to be beneficial in fibromyalgia, such as omega-3 fatty acids. There is a study that showed that among fibromyalgia patients, omega-3 fatty acid supplementation has been linked to significant improvements in pain severity, tender point counts, fatigue, and depression. Another case report indicates that supplementation with fish oil, providing 2,400 to 7,200 milligrams of EPA DHA daily, eased neuropathic pain in a small number of subjects with fibromyalgia and/or related neuropathic pain. Omega-3 supplements can have moderate analgesia-like activity and increase levels of anti-inflammatory prostaglandins. We advise a fish oil supplement that is pharmaceutical grade, free of mercury and free of other heavy metals, as well as free of polychlorinated biphenyls. You want to look for the words molecularly or nitrogen distilled and tested for heavy metals. Another supplement that has been studied in fibromyalgia is SAMe. SAMe has been linked to improvements in morning stiffness, fatigue, quality of sleep, and clinical disease activity among fibromyalgia patients. Ginger and curcumin, which is also known as turmeric, although not formally tested in fibromyalgia, may also exert some analgesic activity by inhibiting inflammatory prostaglandins. Note, co-administering curcumin or turmeric with piperine, which is black pepper, could improve the bioavailability of the curcumin. There are studies that have been conducted on humans and on animals. One study found that when even 2 grams of curcumin was ingested, its serum levels were very low. However, when 20 milligrams of piperine was added to curcumin, the bioavailability increased by 2,000%. Now let's discuss available treatments for fibromyalgia. According to the National Institute of Health, about 90% of people with fibromyalgia use some form of complementary or alternative medicine. This is because most conventional doctors do not address diet and supplements, and because most patients do not improve with conventional therapy. The typical treatment strategy offered by medical doctors is some form of pain medication and perhaps psychotropic drugs like antidepressants. There is spotty effectiveness of traditional pain relievers for fibromyalgia pain. These strategies do not address the cause of the problem. Sleep. Because people with fibromyalgia often have trouble sleeping, sleeping well should be first on your list of essential treatment strategies. LDN often helps with sleep, and I will discuss that more below. Patients also will use melatonin with good results. And it's important to exercise. Now, about exercise and fibromyalgia, unfortunately and understandably, people suffering from fibromyalgia tend to shy away from exercise. But research shows that a combination of aerobic activity and strength training can actually improve fibromyalgia symptoms. In one study by Harvard researchers, after exercising for 20 weeks, women with fibromyalgia reported improved muscle strength and endurance and lessening of their symptoms, including pain, stiffness, fatigue, and depression. You don't want to do exercises that worsen the condition. If the exercise that you do aggravates your pain within a few hours or the next day, you have done too much and you need to back off or switch to something else. You will want to strive for a combination of aerobic, anaerobic, and sprint type exercises and strength training. Start slow and build up your tolerance over time. Other alternative treatment methods for the pain of fibromyalgia are chiropractic care and acupuncture. Both are often utilized with benefit. Now, let's discuss LDN. Through LDNdoctor.com, I see many fibromyalgia patients, and I provide many with prescriptions for LDN, which has been found to be very effective therapy for fibromyalgia. There is one randomized, double-blind, placebo-controlled trial which assessed LDN's impact on fibromyalgia pain and quality of life measures. The study concluded that there was a significantly greater reduction of baseline pain in those taking LDN than in those taking placebo. Low-dose naltrexone was also associated with improved general satisfaction with life and with improved mood. The preliminary evidence continues to show LDN has a specific and clinically beneficial impact on fibromyalgia pain. LDN is widely available, inexpensive, safe, and well tolerated. My approach is to start my patients with an extra low dose, as low as 1.5 or 2 milligrams, and to titrate up as tolerated. I also recommend taking LDN about 3 hours before bedtime, which seems to have the best impact on improving sleep quality and quantity. As I mentioned earlier, good quality sleep is key for healing. Now let's get to our questions. First, our first question that we received through LDNdoctor.com is from Powell, who would like to know, could you please talk about supplementation that could be applied while curing fibromyalgia with LDN? Are there any substances, preferably natural ones, that could bump the power of naltrexone and speed up the whole process of recovery? So, Powell, I've already discussed magnesium, omega-3, SAM-E, turmeric, and ginger. I also advise supplementing with vitamin D, as it is also beneficial to the immune system, and vitamin D has been shown to improve the efficacy of LDN. I recommend a goal of 50 to 60 on blood work. Powell sent in a second question. This relates to the process of healing and the role of LDN in fibromyalgia, and he'd like to know, could you tell specifically how exactly LDN therapy works while curing fibromyalgia and how this process works? The understanding of that is pretty crucial for me, as I've always wanted to know how everything works, especially if it comes to my health. I respect that, Powell, and thank you for your questions. The precise mechanism of action of LDN in fibromyalgia is still being researched. Since fibromyalgia seems to be immune-mediated, and since LDN regulates immune system activity, that may explain the benefit of LDN for fibromyalgia. Rachel has sent in our next question. How soon after starting LDN should I start to see results? And what if nothing seems to be changing by then? Thank you, Rachel. Some of our fibromyalgia patients report feeling better immediately in as little as 1 to 3 days. And some of our fibromyalgia patients report that they don't really feel improvement for a couple weeks. If nothing is changing within a couple weeks, I recommend that my patients update me so that we can have a discussion about adjusting the dose. And we can discuss also improving vitamin D supplementation, which I've mentioned is very important for the efficacy of LDN. Barb is asking our next question. I have been on 4 milligrams of LDN now for 3 months. I just developed a severe rash, which is going on day 6 now. It started on my lips with blisters and then spread to my face, neck, arms, hips, all left side of my body. I just noticed a spot on my right side on day 5. I've been put on prednisone 3 days ago with no improvement. It actually looks worse. What are some of the reasons of why I developed this rash, and how should I treat it? Should I lower my dose of LDN? So there really is no known side effect involving a rash with LDN. The most common side effects of LDN are vivid dreams, not nightmares, and insomnia. And those side effects usually resolve after several days. I have never heard of a rash as a side effect. And also, this rash does not seem related to LDN, especially since it developed 3 months after you started it. So I recommend seeing an allergist or a dermatologist and having that assessed further. Okay, best of luck, Barb. Sherry has the next 2 questions for us. Are there any foods, supplements, or drugs other than opiates that I need to avoid when taking LDN to achieve maximum benefit when one does not have an autoimmune disorder? I'm specifically wondering about caffeine. So there are no known medications besides opiates that are contraindicated with LDN. However, in general, I do not recommend caffeine. Because caffeine is so acidic, it actually may leach minerals from the body, including magnesium, which we've already discussed may have a healing effect in fibromyalgia. Lastly, Joe wants to know, what are the best supplements or drugs for fibro fog? So LDN is great for fibro fog. It is one of the first symptoms that my patients report an improvement in. And it's one of the most improved symptoms I hear about, they call it often brain fog as well. So yes, I recommend LDN for that. So now, unfortunately, we have run out of time. Thank you to everyone who sent in their questions, and thank you to everyone who are watching live. Don't forget, you can rewatch this webinar anytime you'd like by using the same website URL. It will also appear on our website at www.ldndoctor.com under the FAQ page and on LDN Doctor's Facebook page. To hear about future events and other LDN Doctor news, like our LDN Doctor Facebook page and subscribe to our YouTube channel. I hope I was able to provide you with a better understanding of fibromyalgia and how LDN is used to manage it. If you or anyone you know are interested in starting LDN or need a refill prescription, I would be happy to help. Just go to www.ldndoctor.com and schedule an appointment. Thank you, everyone, and enjoy the rest of your day. Bye-bye.